All right, for more on this, let's now speak to Dr Saffiya Umar, Medical Officer at the National Institute for Communicable Diseases of South Africa Outbreak Response Unit. Welcome, Dr Umar, and thank you so much for your time. So, I mean, just hearing that, it's been over just a week before the first outbreak, and we're now already sitting with 117 cases and rising. Is there enough being done to stop the spread of hand, foot and mouth disease in Durban, especially given what we're hearing that it is contagious?
Hi, thank you for having me on your show. To answer your question, the KZN Department of Health, specifically the eThekwini municipality, are on the ground as we speak. And they are busy with screening cases or potential cases for hand, foot and mouth disease. They have started with their surveillance efforts as well as community outreach and education. And from our side at the NICD, the Outbreak Response Unit, we are also providing technical support in terms of, as you rightly heard, I did have a talk with some of the teachers of the affected schools, and that happened last week, Friday. And on Wednesday, we're also having some training and education with healthcare workers. In terms of hand, foot and mouth disease being contagious, this is rightly so, but it is a mild self-limiting illness. So within 7 to 10 days, all the symptoms should have cleared.
All right, so there's no need to panic in that, it is a mild viral infection, as you pointfully, say. In terms of the technical support that you are providing, I would imagine whatever it is that the teachers are then informed with, that gets passed on to parents. Can you give us a sense in terms of what that entails then, in terms of that support?
Yes, absolutely. So I think it's very important. I think education is one of our most vital tools. What we had discussed during that meeting is the transmission, so that's the propagation of the actual virus. It is highly contagious, but with simple efforts like proper hand washing, which we discussed on Friday, and this entails sort of also discussing with the educators, washing with water and soap, hands under the tap for longer than 20 seconds, we basically trying to propagate this information or disseminate this information into the communities. So it's simple things like hand washing. If you notice that a learner is unwell or ill, please send them home. And then just basic hygiene. When you cough, sneeze, do it into a closed elbow. Don't cough and sneeze into your hands. Wash your hands before you eat. The virus actually enters the body through the eyes, nose, and mouth. So try to educate the learners not to be touching their face unnecessarily. Prior to eating as well, washing the hands. So it's basic things that are going to, or basic infection control measures that are going to help us stop the spread of this illness.
Dr. Umar, just give us a sense then in terms of the symptoms. I mean, we know that it is contained at this point in the northern parts of Durban, but there is concern, you would imagine, in the country as a whole in terms of it, spreading to other provinces.
Sure. So the symptoms that you would notice, and it is sort of a virus that you find in under 10-year-olds most commonly, and we do commonly have outbreaks in schools and creches. But the things that the parents as well as the educators need to look out for are sort of your flu-like symptoms. So a fever would be one of them. In the very young children, your creche-going age, you look for irritability, lethargy, and basically a child who's not playing and not happy. That would be one of the signs that they're not feeling great. Within the mouth and the mucous membranes in the mouth, there would be sores that develop or blisters, and the child might complain of painful sort of eating, swallowing, drinking. And that's one of the signs you look out for. And a few days later, they might develop a rash on the palms as well as the soles of their feet. And those are sort of classical symptoms of hand, foot, and mouth disease.
And I mean, just having listened to some of the authorities in KZN, obviously going at pains to explain, as you've also indicated now, that it is a mild, disease. We are hearing, of course, that it does predominantly occur during the summer months and autumn. We are heading to autumn and winter. Are we likely to see it dissipating during that time?
So look, I think with the surveillance that the KZN and eThekwini municipality are doing, I think that would give us sort of a better indication of what's going to happen or the extent of the hand, foot and mouth disease over the next few weeks. So I think that's data we're going to look out for.
All right. Thank you so much for your time, Dr. Umar. Really appreciated. That is Dr. Saffiya Umar from the NICD of South Africa, of course, the Outbreak Response Unit there, just monitoring developments on that particular disease in KZN.